Do you know the Alzheimer's disease symptoms or the stages of Alzheimer's? This video will give you all the answers. It also talks about the newest medication approved by FDA in 2021. To manage symptoms of Alzheimer's, choose appropriate medications, or provide proper care, it is important to recognize the stages of Alzheimer's disease. Alzheimer's disease progresses in 4 stages: preclinical, mild or early stage, moderate, and severe or late stage. Preclinical. Alzheimer's disease has a complicated onset and progression. The brain is probably in the process of being damaged for a decade or more before memory or other cognitive problems show up. People appear to be symptom-free at this stage and live normal life, but under the surface, toxic changes in the brain are taking place. Mild Alzheimer's disease. A person with mild Alzheimer's disease may appear healthy, but the patient has increasing difficulty making sense of the world around them. It might become impossible for them to live an independent life. It takes time for the person and their family to realize that something is wrong. These problems are as follow. 1. Memory loss is the most common symptom, for example, forgetting things just learned, losing track of important dates, and repeating questions. 2. Poor judgment leads to bad decisions. For example, giving money away to people they barely know. 3. Withdrawal from work or social activities. They are less involved with favorite hobbies or lack motivation. 4. Taking longer to complete regular daily tasks, like grocery shopping. 5. Trouble handling money and paying bills. 6. Wandering and getting lost due to the confusion of time and place. 7. Losing things or misplacing them in odd places and then accusing people of stealing. 8. Mood and personality changes. For example, get upset more easily, feel depressed, anxious, and suspicious. 9. Some might even develop disruptive behavior like anxiety and aggression. Moderate Alzheimer's disease. As the disease progresses, more intensive supervision and care are required at this stage. It can be difficult for spouses and families. It is the source of significant physical stress, as well as strain on the relationship. Symptoms could include 1. Increased memory loss and confusion. The short-term memory is the first to go, then progressively the long-term memory. Childhood memory is the last to retain. 2. Inability to learn new things and cope with new situations. 3. Difficulty with language and problems with reading, writing, and working with numbers. 4. Difficulty organizing thoughts and thinking logically. 5. Shortened attention span. 6. Difficulty carrying out multi-step tasks, such as getting dressed. 7. Problems recognizing family and friends. First, the patient does not recognize their children, and then the spouse. At the last stage, it is not uncommon for the patient to anxiously look for the mom to take them home. 8. Hallucinations, delusions, and paranoia. It could cause a great disturbance to the life of the patient and family. 9. Impulsive behavior such as undressing at inappropriate times or places or using vulgar language. 10. Inappropriate outbursts of anger. 11. Restlessness, agitation, anxiety, tearfulness, wandering, especially in the late afternoon or evening. This is called sundowning syndrome. 12. Repetitive statements or movement, occasional muscle twitches. Severe Alzheimer's disease. People with severe Alzheimer's disease are unable to communicate and are reliant on others for care. The care required at this stage quite possibly exceeds the family's coping ability. Professional care facilities like nursing homes might be a more suitable environment. As the body shuts down, the person may spend most or all of the time in bed near the end. Their symptoms frequently include 1. Inability to communicate. 2. Weight loss. 3. Seizures. 4. Skin infections. 5. Difficulty swallowing. 6. Groaning, moaning, or grunting. 7. Increased sleeping. 8. Loss of bowel and bladder control. Aspiration pneumonia is a common cause of death in people with severe type Alzheimer's disease. This type of pneumonia occurs when a person is unable to swallow properly, allowing food or liquids to enter the lungs. If a person demonstrates a few of symptoms mentioned above, how do the doctors make a diagnosis? What treatments are available in the year of 2021? How do primary care doctors diagnose Alzheimer's disease? Doctors use a variety of methods and tools to help determine if a person suffering from thinking or memory problems has Alzheimer's disease. History gathering. Doctors will inquire with the patient and a family member or friend about overall health, medication use, diet, previous medical problems, ability to carry out daily activities, and changes in behavior and personality. Psychiatric evaluation. A psychiatric evaluation should be performed to determine whether depression or another mental health condition is causing or contributing to a person's symptoms. Memory, problem-solving, attention, counting, and language tests are also performed. Lab test. Blood, urine, and other standard medical tests are useful to rule out other potential causes of the problem. Brain scans, such as computed tomography or CT, magnetic resonance imaging or MRI, or positron emission tomography or PET, might be ordered. These scans can confirm an Alzheimer's diagnosis or rule out other possible causes of symptoms. All these tests help in determining how a person's memory and other cognitive functions evolve. The tests can also help in the diagnosis of other causes of memory loss, such as a stroke, tumor, Parkinson's disease, sleep disturbances, medication side effects, an infection, or another type of dementia. Some of these conditions are potentially treatable and reversible. What specialists help to diagnose Alzheimer's disease? If a primary care physician suspects Alzheimer's disease, they may refer the patient to a specialist for a more detailed diagnosis or further evaluation. These specialists include: geriatricians are doctors who specialize in the health care of older adults. They have more knowledge of how the body changes as they age and whether symptoms indicate a serious problem. Geriatric psychiatrists are experts in the mental and emotional problems of older adults. They are especially helpful when the patient experiences depression, hallucination, delusions, and paranoia. Neurologists specialize in brain and central nervous system abnormalities. They can further rule out other diseases affecting the brain and help to finalize the diagnosis of Alzheimer's. Neuropsychologists can conduct tests of memory and thinking and help to finalize the diagnosis of Alzheimer's. In addition, memory clinics and centers provide multidisciplinary teams of specialists who collaborate to diagnose the problem. They may have ready access to more advanced diagnostic tests. After a diagnosis has been reached, what treatments are available at this day and age? Because Alzheimer's disease is so complex, it's unlikely that any single drug or other intervention will ever be able to successfully treat it in all patients. The U.S. Food and Drug Administration, FDA, has already approved several prescription drugs to help manage symptoms. On June 7, 2021, the FDA granted accelerated approval for aducanumab, a medication that helps to reduce amyloid deposits in the brain and may help slow the progression of Alzheimer's. However, we need to understand that there is no cure for Alzheimer's disease at present. In general, most medications work best for early to mid-stage Alzheimer's. Treatment for mild to moderate Alzheimer's. The goals of treating Alzheimer's disease are twofold: symptoms management and treatment of the disease itself. Symptoms management. Symptoms management can help the patient live a life with more comfort, dignity, and independence. It also provides much relief for their caregivers. Galantamine, rivastigmine, and Donepezil may reduce and control some cognitive and behavioral symptoms. These medications are cholinesterase inhibitors. They prevent the breakdown of acetylcholine, a brain chemical important for memory and cognition. Disease-modifying medication. These medications target the underlying causes of disease. Aducanumab is the only disease-modifying medication approved for the treatment of Alzheimer's disease as of 2021. This medication is a human antibody that targets the protein beta-amyloid and helps to reduce amyloid plaques. These are Alzheimer's-related brain lesions. Treatment for moderate to severe Alzheimer's. Memantine works by regulating glutamate. Glutamate is a key chemical inside the brain. It can cause brain cell death if produced in excess. This medication may retain patients' ability to perform some daily functions. For example, it may help a late-stage Alzheimer's patient to brush teeth independently for several more months. Donepezil, the rivastigmine patch, and a medication composed of memantine and Donepezil are also approved by the FDA to reduce the symptoms of late-stage Alzheimer's. Medication S for behavioral symptoms of Alzheimer's disease. Sleeplessness, wandering, agitation, anxiety, aggression, restlessness, and depression are common behavioral symptoms of Alzheimer's. Treatment of behavioral symptoms makes people with Alzheimer's more comfortable and things easier for caregivers. In general, behavior symptoms are best managed by non-pharmaceutical means, such as behavior therapy, music therapy, occupational therapy, etc. However, if the above-mentioned measures are not sufficient, medications are needed. 1. Sleep aids are used to assist people to sleep better. However, these medications should not be used on a regular basis because they make the patient more confused and prone to falling. 2. Agitation is treated with anti-anxiety medications. The side effects are drowsiness, dizziness, falls, and confusion. Therefore, they should be used only for short periods of time. 3. Anticonvulsants are sometimes used to treat severe aggression. 4. Antipsychotics are used to treat severe behavioral symptoms such as paranoia, hallucinations, agitation, and aggression. They can increase the risk of death in some dementia patients, so should be used with caution and under the advice of a doctor. Now, this video is completed. In the next few videos, I will talk about caring for people with Alzheimer's disease. If you liked the video, give it a thumbs up and share it with your friends. Comment to share your thoughts. If you want more information on topics of older adult health, subscribe to the channel.